Buenos días, buenas tardes.
Good morning, good afternoon. We're going to wait a couple of minutes and then we will begin.
Kelly, your voice is muted.
Tienes
Thank you,
apagado.
thank you. Thank you. Good morning, good afternoon. Just letting you know, we will start in a few minutes. This will be translated in English and Spanish. There is a button below where you can choose which language you would like. Thank you. Y mientras estamos esperando, por favor.
While we are waiting, please place on the chat your name, your organization's name, and also the country from where you are joining us today. Thank you.
Y también si pueden
And
ponerse.
also, please mute your microphones. Thank you.
English and Spanish.
Welcome. As you can see, we're going to have this webinar in Spanish and also in English. This transitioning learning event for this workshop that is interactive, being organized and hosted by the Transitioning Residential Care Working Group as part of the Transforming Children's Care Global Collaborative Platform. I know that many of you are already members of this platform, of this group of transition. But if not, and you're interested in becoming a member, we will have information at the end of this webinar. Thank you. Next, please. Okay, as I said, good morning, good afternoon, good evening. It's a pleasure to be with you. My name is Kelly Bunkers, and I am Senior Technical Advisor of the initiative Changing the Way We Care. Oops, please mute your mics. Please mute your mics. Thank you. We have an excellent webinar, super interesting, and it's my pleasure to have so many colleagues and I can say friends of many places in the world that are participating and that are presenting today. Next, please. Okay, so just some housekeeping before we begin. This meeting is being recorded to support the preparation of the outcome report. You can, and I can see on the chat that you're already presenting yourselves and placing your name and the country, your organization. Please use the chat for any question you may have. We will have time for questions and answers, and the chat can also be answered by our presenters on the chat. We will also have polls, so please answer those polls. And please keep your mic muted and your video off also when you're not speaking. Thank you very much. Let's just begin. Next, please. So today we have a full agenda, very interesting. We're going to share a synthesis of learning and transition from Cambodia, Myanmar, Kenya, Rwanda, and Guatemala, and also Mexico. And then we will have small group discussions. Please mute your mics. Thank you. We're going to have breakout group discussions where we can see the relevance of the subjects in your context and what are the implications at a global level. And on the third part, we're going to have experts of the government and also civil society and also people with lived experience that they will share concrete actions in this transition part. So it's a full day, but I am super happy to have these experts, all these people that will be doing the presentations. And I think it's important now, before beginning, to explain a little bit or define what is transition. We, in this case, we understand that transition is a process of changing from one model or one type of service focused on residential care to a model or a service focused on family care or community care. So, this is linked to reintegration of children and adolescents, and it's also linked to care reform. But today, please mute your mics. Thank you. Please mute your mics.
Vamos a esperar hasta que
We're
todos.
going to wait so everybody can mute your mics. Thank you. Okay. So, as I was saying, the transition is linked to reintegration and also to care reform. But today, we're focusing only on the process of changing from one residential model to a model or a service based on family or community. Next, please. Thank you. Excellent. Now it's my pleasure to present David McCormick, who is a technical consultant and has worked in the name of children and adolescents for more than 19 years. David now is a technical consultant of the initiative Changing the Way We Care, Faith to Action Network, and also Better Care Network. He always is promoting family care in Guatemala and in the complete region of Latin America. It's my pleasure to introduce David, who is presenting from his house in Guatemala. David, please, the floor is yours. Thank you, Kelly. I am going to try to speak slowly, but it's really hard. But if I'm talking too fast, just let me know. My name is David, and we're going to talk a little bit about this learning synthesis. Next, please. And just to clarify, in the use of this presentation, I am going to talk about, I'm going to say centers, and in English, we see the RCI, which is residential care institutions. Next, please. So the countries that we analyzed in this synthesis, we considered Kenya, Cambodia, Myanmar, Guatemala, Mexico, and these countries have studies and reports that have information on transition, and there are different geographical areas because there's different anthropological context, and so we're going to have a wide perspective to these services at the global level. Next, please. For this synthesis, as Kelly was explaining, we consider three different levels. Of course, we have the macro, where we see those broader systems that includes government and different factors at a macro level, and micro, which is the reintegration of children, adolescents. But in this morning, we want to see the influence of macro and micro, and we're going to go to the meso on how these aspects affect different countries, that transition of services at an institutional level. Next, please. So, to begin with, considering that structure, we're going to see some catalytic elements at a macro level that affect the meso level in the transition of services. So, in the different countries, obviously, government has a very important role, and to understand and the commitment of the government influences how the transition is seen in the countries. In countries that have specific levels of transition are accompanied by organizations of civil society, and the influence of this CSO in the work with government, when it is handled at a strategic level, at a national level, an orderly way. We can see, for example, in Cambodia, Rwanda, and Kenya, the different CSOs have been able to coordinate with the government specifically where they are training the. Please remember, keep your mics muted, where they're giving training to the staff in residential care to adjust to the changes. And when this type of coordination is taken with a CSO, there is trust for the different organizations because they have the structure, but also the access and the access to the knowledge and accompaniment. So it's always necessary to have a change in legislation when the country can present new policies, new legislation, but obviously this alone does not make the changes in institution, and it has to have the strategy and the support from civil society. Next, please. Here we see 4 countries with different moments and in these countries, and these 4 countries have many things in common. They have policies, they also have moratorium, they have certain strategies, but we see differences in the field because we can see a Rwanda that has been able to implement care reform that goes to the transition in a very effective way, and it's followed by Kenya, then we have Cambodia, and then we have Myanmar. And these 4 countries have had the cooperation of civil society with their support for those transition of services, specifically in training on case management, reintegration, and we can see the importance that government may comply with the civil society organization. And we can say that when the government cannot implement their policies or strategies, as we can see that Myanmar, that they still have to implement it, civil society is left out of the power of that transition. And they continue to have no accountability, and the government can't have that accountability from residential care institutions. So when the government implements with civil society support, this contributes with reintegration, so that when these elements exist in a country, we can see that children and adolescents are reintegrated in a safer place. So in the micro level, as we can see that influence, that the children are safer in the families when it is followed by this context. Next, please. Another important thing that we have to understand, that we have countries from Asia, Africa, Central America, North America. It's important to understand the cultural aspects. In Rwanda, we see that the transition of services is aligned with cultural aspects of family. This helped the care reform because there was a trend to take care of the children and adolescents in their own families, and this favored the transition. In Cambodia, they also have community-based mechanisms for alternative care. So we can see that as cultural aspects are important because it makes it easier for transition. But again, it's structure, it's legislation, it's strategy, and these cultural aspects are strengths. We can see in Rwanda that these were activated and that allowed to have that potential in the transition. Next, please. And in the communities, in the same communities, we can see in coordination with civil society.
They have trained volunteers in Kenya and Rwanda, at least. We know that there are some other countries, but at least we have the reports of these countries. And the presence of these volunteers in the community is the reintegration and the gatekeeping process, the transition of the centers of these residential centers. And in the community where they have a positive aspect of the centers, they actually help that they continue working in the best way. In the residential care institutions, we see that there is a pressure in order to speed up the transition. There is a raising awareness in the situation, even in the communities. They are helping to express the transition of services. And actually, it can ease the reintegration. That is an essential element of the transition. Let's go to the next one, please. Now, we all are related with the pandemic. It is, hasn't taken a long time, but it has affected the transition at the institutional level. It has been a very important factor that speed up the transition in some of the residential care centers. Many governments had a good response on this in order to reunify children, and the restrictions all actually increased, and it decreased the practice of tourism as volunteer. And for example, in some countries we have seen in Kenya, in some other countries, it has a good factor for the transition. Let's go to the next one. Another aspect that we need to verify from the pandemic is that there has been a loss of the donations, and actually they had to reduce the size of their programs, and not necessarily they are looking for the transition. Some of the centers, for the first time, they actually could have the experience of reintegration of children and youth, and it has been a positive factor in order to embrace the idea of changing the service model. Let's go to the next one. And now talking about the attitudes, about the transition of services. Kenya, we can see that there are some residential centers that they have some previous experience. And when they are achieving the reintegration, that is an essential element for them. And we see that based on the experience, and a positive experience in reintegration, they actually have the benefit of have very concepts on this. However, on the other hand, in Cambodia and in Myanmar, since they don't have a lot of policies of implementation, so many centers have handled the reunification as an additional program for their own benefit of their programs and not for the catalyst of the transition. We cannot assume that reintegration practice is besides a natural transition. No, we have to consider that it's part of an effective strategy in order to guide the directors of the centers in order to lead them to a transition. Reintegration is a practice, and we have to hear the voices of children and youth. For example, in Rwanda, they actually use it as a practice. It is essential to provide the accompaniment in order to feed the change. Let's go to the next one, please. And here we see an example from Mexico. And it is a representative for other countries as well. And there are some Catholic centers where they have a good space and they receive some guidance according to this kind of service they have to provide. And they receive some instructions from Rome, but they have left that guidance in order to follow new guidance on behalf of the populations. And the pressure does not come from the government, but from the main office in Rome. And it's important to understand that that is another macro element, that it's a guidance for the transition movement in so many residential care centers. Let's go to the next one. We have patterns, and some patterns that hinder the transition with low implementation. We have a poor documentation for the record of children. And it's actually difficult because the directors don't have that intake to take decision. Sometimes they have a poor case management, and it becomes harder for them because they cannot think of concrete steps in order to go to the transition. Next one, please. And something important that I mentioned is that in Kenya, Rwanda, Cambodia, Myanmar, they have moratoriums on the record of new centers. And in Guatemala, that is not happening. That is sending us a strong signal. The government has a position, very solid position about the residential care, and they are willing to regulate the operation of the centers and the services. When the centers feel the pressure of the government implementing policies, they actually have to obey the processes and they must take actual steps for the services. Next one, please. And now, I'm sorry that I am speeding up, but we have lots of information in so few minutes. Okay, so And as a last point, we have the donor influence. And that is another important aspect that actually was an outcome from the synthesis. And we could see that a lot of donors have influence of the operations of programs. And sometimes they have achieved to have this transition of the service, but in some other cases, they are an obstacle. And we can see that both positions on how they are handling it, but we need to pay attention to understand what is the process of the donor and their influence in order to find the support on this transition. Well, thank you so much for your attention. I know that I have loaded you with information, but I appreciate the attention that you have given to this. Thank you. Thank you so much, David. It has been very interesting. I'm so sorry for the interruptions. And I believe that your information has been fundamental. I still don't see any question on the chat, but if you have a question, please, it is the right time to ask in English or Spanish. And we are going to have just a minute to check out if there is some questions. No? Well, I see lots of participants from different countries. And actually, David mentioned some of your countries. That's great. David, maybe there is a question, I believe. There is a question. Marcus asked something. David, how is the transition process currently in Guatemala? Maybe, David, can you take a minute in order to answer to that question? Well, Guatemala is one of the countries that, as I mentioned, there is no moratorium on the new residential centers. They still provide some authorizations, and we have some representatives of the entity, CNA, it's the name, and actually there is no a specific position or a strategy that supports the transition. I know that within the government, there are some guidance in order to search for the transition, but still there is needed coordination with government and CSOs in order to find the reforms to have that impact on transition. So there are so many organizations that are working on transition because they don't want to have the same cases in the past. We have seen that some organizations have the cases and they don't want to continue in the same situation. Thank you, David. And I see that Aditya has a question. Now I see some questions. And she's asking how these studies findings can be reflected upon other developing countries. And I believe that we are going to discuss that in the breakout rooms. We're going to have a specific space where we are going to be able to speak about it, to discuss the topic. Okay. Oh, I see lots of questions. I believe that maybe David will be able to give the answers within the chat because we're going to have a coffee break and we're going to take that time. Okay. Okay. We are going to move on, and I believe that we have some polls. Okay, we have the polls over here. Okay. And here we have that. And you have the poll on your screen. And it says, these findings share similarities with my own experience and or context. Number 2, included some new insights I had not come across or considered before. And number 3, were quite different to my experiences or context. Okay, would you please answer this poll number 1? What about these findings? What is for you? 1, 2, 3? You can see that on your screen, right? Okay. We are given a few seconds for you to answer. That's important for us because it's a lesson that we want to learn from it. Is that similar to your context? It's totally different because we have participants from all around the globe. We have 30 seconds left. Please, everyone, answer to your poll. Okay, excellent. Now we can see the next one. Oh, great. We have the results. And more than half of the attendees share your experience that's similar to your context. More or less 40% of you have some different things and some similar, and only 4% have totally different. David, what do you think? Does it surprise you? Well, obviously, every country is unique. It's different. And we all have things in common. And we see that transition is possible in every country around the globe. And that encourages us. Wonderful. And also for me, it encourages me too because we can share about it in order to learn from different contexts. Excellent. Okay, let's go to the next thing. Wonderful. Oh, great. Now we are going to have our breakout discussion groups. And we have 4 breakout discussion groups. We have 2 in English, 2 in Spanish, and the questions that we will be discussing are, okay, let's see the slide, please, with the questions. We want to see the questions. Okay. Oh, here we have the questions. Okay. And as I said, you all have to choose your group. Do you want an English speaker group or a Spanish one? What do you want? But you are going to discuss these questions. The number 1, what the implications of the findings for global level advocacy efforts might be and how these efforts could be strengthened. Okay, the focus is on a world level, okay, a global level. And the question number 2, what the implications for country level strategies and action plans may be, and how national efforts to support, coordinate, and scale residential care services transition might be strengthened. Okay? And in a breakout discussion group, we're going to have these 2 questions. The first one is related to the global approach. What do we have to do as a sector in order to promote the transition? And the second is related to the national context, your context. What are the implications of the strategies, the coordination, and others? Okay? Now we are going to see, okay, great. They are the facilitators. They are great friends of mine. We have Suli and Phil will have the Spanish groups, and Khadija and Ashley will be in English. And now, can you invite us to the group? How are we going to do it? Okay. At the bottom of your screen, you see the breakout room button, and you will be able to choose the breakout room that you want to belong to. You press the button, it appears a small screen, and then you join to the breakout room group. Please remember that when you come back, you have to choose again your English channel. Okay. You see that at the bottom of your screen, you have the breakout room button. Please press that button and then it will appear, it will pop up another small screen and you have the different groups that are available, two in Spanish and two in English. Great, we see a lot of people joining. We have you all participate in these groups. Thank you.
Veo que algunos están regresando.
Very good. I see some of you are coming back. So we're going to wait for a minute while, if you can, remember to choose the language of your preference, be it Spanish or be it English. On the bottom, you can see interpretation and choose. Excellent. Welcome again to the main room. If you can, please choose the language of your preference for interpretation, be it English or Spanish. Choose the language of your preference again. Great. I hope that you've had the time for having important and interesting discussion on what we can do, what are the implications of the findings at a global and local level. Now we're going to give 1 minute to each of the facilitators so that they can give us a summary of the discussions that took place. So let's begin with Suli, please. I think Suli is group number 1. Please, Suli. Yes, thank you very much. In our group, it was a very lively discussion. We weren't able to finish, but there is a lot on the chat. So summarizing, we believe that at a global level, we have to disseminate this knowledge because it's important to insist on what transition of services means. And it's not to see it as in black and white, but there are different alternatives. And something important that we talked about is that besides the dissemination, we have to work and to develop everything that is necessary to strengthen families, strengthen the participation of children and adolescents in this process, and not to forget that the children with disabilities have to be included and represented, that at a global level. And at a country level, we only were able to have a small discussion, but it's important that the different entities may begin to promote that transition and to consider the moratorium in the beginning of the transition in the different residential care. So that would be a summary. Thank you, Suli. Super interesting key messages. And just to add that all the information we're going to pilot and to share with you all later on. Thank you, group number 1. Group number 2, I don't remember who it is, but Alicia or Ashley?
I can't see the name, sorry. Yes, Khadija.
Yes, please. Can you give us a summary for a minute? Please open your mic, Ashley or Alicia.
Khadija, no sé si estás
Yeah,
hablando. Okay, ahora.
Yeah, sorry about that, Kelly. So a lot of discussion was actually going on the Jamboard itself, where lots of feedback were being pulled onto the Jamboard. And amazingly, there has been like key cross-cutting themes where both at the global and national level have really come out. And one of it is the importance of donor engagement on issues around transition. So like having communication, how best do we communicate to donors around issues of transition? The other one that was coming out strongly from the team is elements to do with caregiver engagement, you know, from this entire process of transition of care, there's important consideration to be made around engaging a caregiver in the process. And then one outstanding thing for the global level is how do we bridge that gap between the national policy movement and the localized implementation and, you know, that global level consideration. Then one of the interesting things that I picked specifically at the national level is what is this measure of success? Unit of measure of success do we want to pull together for us to be able to say this is successful transition? So very outstanding thing, which I think the team has really brought up. And how do we measure transition, a successful transition in terms of our work? Very important. Otherwise, lots of discussions were going on onto the Jamboard, which I picked those 4 main areas for presentation. Thank you, and back to you, Kelly.
Excelente, Khadija.
Excellent, Khadija. Thank you very much. Group number 2, we're going to collect all that information and to share it with you later on. Ashley, yes, please, 1 minute to summarize.
Thank you. Let me get this a little bit larger. Okay. Yes, we had a lot of great input on question 1. Really, one of the great points was talking about how do we push towards global change and global transition of services internationally and use urgency and stronger messaging when there might be a need for residential care, like in a country where there is not the landscape to fully transition every care facility. How would we help governments understand the urgency while that is still a needed service? In Cambodia, there was some mention of in Cambodia and in Thailand where there's more government directives, but there just weren't enough services built up, and where that can put children at risk. And then sometimes where then the messaging is very strong, it can lead to more resistance for organizations that are running children's homes. Another impact is the challenge of how we have all these high-level measures and ideas around transition and the importance of it, and all of us are working really hard in this effort to communicate that, but then we have the ideas that contrast of the external actors, so donors, home directors, and so at a global level, we need more universally understood messaging that can be clear for all of the different parties that are represented in this space. I think the last part on that question was just that governments have agreed to these efforts, but then they need to embrace and implement protocols at the national and local levels to where that it's more broadly understood that this is the direction that we're going, but there's just not as much effort towards the implementation or a budget put towards that. For question number 2, we talked about how governments need to take responsibility to care for and protect their own children. And that needs to be factored into the budget, where so many, again, where people have agreed to these efforts, but then there is not clear budget for how this is going to actually be implemented. And so that gap needs to be filled. And then it's important to engage resistant institutions. So whether people are interested in transitioning or not, that it's important that we're bringing everyone along in the way. And then that we need more additional guidance tools. So we need to have more specific local level contextualized tools for how transition happens, where there's this big gap on the how of implementation. And so
Excelente.
the other part just being that,
Gracias.
okay.
Thank you, thank you.
Yeah.
Thank you.
We had a lot of good input. Thank you.
Excelente.
Thank you, excellent. And I'm sorry, but I love it to see these subjects in the 3 groups. And now number 4, Philip. Excellent, Kelly. Thank you very much. So we focused at a local level, and I have a global comment. We have to have studies and a long term for reintegration and how the indicators of success that we have had at a national level. We talked about 5 things: the need for training, continue training, the guidelines and how to implement. And at number 2 is to have a national plan, to develop that national plan that will help us as a country. Number 3, to work on legislation and policies and regulations, and to have a moratorium for registration of new residential cares. And number 4 is to improve the practices of reintegration. And because a family without training, without follow-up is going to fail. And we have to monitor families better. Number 5 is to work with NGOs and communities and to improve our interaction and to see how we can work together to be able to achieve our goals. Thank you, Kelly. Excellent. Thank you, Philip. And again, if you have any problem in hearing, just choose the translation, be it in English or Spanish. Okay, thank you, facilitators, participants. I believe we have a lot of interesting information, and I know that we have participants that represent government institutions and also NGOs. So I think that we have important suggestions and ideas for each group, and we hope to continue considering all of this discussion. Now we have a coffee break. We have, let me see how much time. I think it's a 5-minute coffee break, but please come back with all your energy because we have great presentators and they're going to share their own live experience. And we also have government representatives and civil society. So we're going to hear from their own experiences. So please, if you can come back in 5 minutes for the second part of this excellent webinar. So thank you, everybody.
Hello and welcome, everyone. After the short coffee break, I'm your moderator, Anju Pun, and I work with Forget Me Not Nepal, based in Kathmandu. I would like to thank each one of you for taking the time to join us today in this learning event on transitioning residential care services. This workshop is organized and hosted by the Transitioning Residential Care Working Group as part of the Transforming Children's Care Global Collaborative Platform. I would like to move ahead introducing you to our panel's experts representing care experienced governments, and civil society from Kenya, Nepal, Thailand, Uganda, and Costa Rica, sharing the guidance and concrete actions that are most critical to catalyzing and supporting transition in their countries. Meanwhile, I would also like to request our friends to share their organization, their names, and the country where they're working if you have just joined in. Thank you. During this session, the main goal is to provide specific guidance to policymakers, practitioners, leading country level efforts to transition residential care services and to support them to implement commitments made at the international level to phase out residential care institutions. The insights and learnings will be incorporated into the thematic brief for residential care service transition that is being developed by the Transition Working Group as part of the Transforming Children's Care collaborative platform. Our panelists of experts will be sharing in a while, which will be followed by 30 minutes of question and answer discussions, where my colleagues will help to translate questions in Spanish, and then we have a second poll. To help you all throughout the learning event, we have a chat box to source your questions, so please feel free to drop in your questions as our speakers will present. So friends, let's begin. I'm very excited to welcome our first speaker, Peter Kamau from Child in Family Focus, Kenya, representing Care Experience Experts Panel. Peter is a child protection practitioner with 16 years of experience. His passion for family-based care advocacy is compelled by his upbringing in institutional care. In addition to serving as a consultant in transforming care, he leads the Child in Family Focus team, ensuring that the organization's vision of a Kenya where family-based care for orphaned and vulnerable children is the norm rather than a privilege realized. Welcome, Peter. Thank you.
Thank you. Thank you, Anju. And it's great to be here today. And I'll jump right into my presentation on elements that enable residential care transitions to be pursued as well as scaled in the country context I am representing and I'm in. And yes, first and foremost, we have the political will. What was in place? Next slide, please. What was in place in our country is that first and foremost, we had political will. And political will meant that we have a government that has taken a stand and encouraged its citizenry, the child protection sector, to take on, the whole issue of family-based care seriously and support transitioning of children and institutions, actually. And so that was very, very helpful. And when you have a government that is supportive, then it makes work way, way easier because it meant it is easy to convince practitioners to take, a lead as well as support these efforts. We also have the government equally had put in a moratorium on registration of new institutions for children. And that also meant that word was all over that, yeah, Kenya is very, very emphatic in insisting that children actually should be retained in families, and for those that are running institutional care facilities, that they need to work, towards transitioning. We also have social protection policies as well as efforts by the government to strengthen families and prevent the separation of children from their families. And so those equally were very, very helpful and a boost in this work. Not forgetting that even for those that were taking children sort of into institutions and they required court committal orders, there was already a judicial sort of move or decision that the longest they should commit children into their care, into the care of these institutions would be 3 years at most. And so that meant the old practice of committing children into institutions for till the age of majority was something of the past. But at the same time, we had, as a country, enabling legislation, policies, and guidelines. And there was mention earlier, like in the breakout group that I was in of the UN guidelines. But then Kenya had already domesticated these UN guidelines for our context. So in 2014, we had our guidelines out and they were launched in 2015. But at the same time, the Children Act at the time was equally very, very supportive of transitioning and had provided for alternative family care for children. We also have the National Child Protection Policy that was equally very, very strong and insistent that the family is the best place for children. But away from that, also we have relationships and the use of multicultural, multi-sectoral approaches. For example, acknowledging that even transitions cannot happen in isolation of different actors and players, such as the health sector, such as the education sector, as well as also the faith-based sector, and considering, we call them the 7 mountains of society, the education sector, the health sector, the media. You have to engage all these sectors together. And so that helped to actually support the transition in peace. But also how we communicated this change as well as these efforts was very, very important, because if you went in with a bashful approach as well as a combative approach for institutions, that was not helpful at all. So you had to go in as the listening and the caring partner, and one that actually sort of appreciated the work they had done, because that was the only way they knew how to do it, and endear them to this other way of doing things. And so that was also something that worked and proved very critical. Not forgetting also the voices of care experienced persons like myself and many others. We have in Kenya, for example, the Kenya Society of Care Leavers. And there were so many voices that were for this agenda, for transitioning. And that was a big, big boost. And also when those that are involved in running institutions are able to sort of hear lived experiences, as well as our perspectives, as well as also take a retrospective look at the children that they took care of and how they're doing and faring in the later years of their lives, they were able to actually take this particular issue seriously and help. It definitely very, very played a significant role. Not forgetting also, as a country, we also have the critical mass component, the networking, as well as the peer learning. In Kenya, we have the Association for Alternative Family Care of Children, which is a coalition with around 34 civil society organizations that are inclined to supporting, strengthening of families. Some of them are running children's homes or orphanages, and coming in together to learn was very, very helpful on a peer-to-peer sort of level. Next slide, please. What hampered effectiveness was the whole behavior change issue. When this change was communicated in a way that was very high-handed, that was not helpful, because there was equally some pockets of rebellious
Porque se habían dado alguna situación.
And that was definitely tricky. But also we have the lack of demonstrable alternatives and successful practices or documented transitions. And it meant those that were keen on transitioning did not know whether there existed a model that they could look at or follow. And so that equally was not very helpful. We did not have transitioning guidelines as a country, and the guidelines that were there or the tools were from other contexts. And so they were not necessarily applicable to our context. But also the workforce required to be technically sound as well as able to support these transitions. And the fact that there wasn't much training, there was not much capacity input towards making them able to support transitions proved a bit hampered effectiveness as well as the success. Not forgetting also that we have the coordination component, whereby At the top level, you find the coordination was a bit very, very not in place per se, because they were all coming to terms with this new reality of changing how children are supposed to be cared for. And it also at some point was called the deinstitutionalization agenda, which was perceived as a closure of institutions. And it's until very recently that it has changed to transitioning. It's a transitioning conversation and not closure, because when we use such terms, they meant that it was very, very difficult to get the uptake. But also resources were equally another big challenge. Next slide, please. As far as recommendations for policymakers are concerned, and those that are advancing this agenda globally, it's also very important to remember that the best interest of a child ought to be emphasized, that children and their best interests have to be taken into consideration. And it's an overarching principle across all transition processes, and that services have to be designed and offered based on the needs and interest of these children. And the one-size-fits-all approach does not work. And you find that it's very, very important equally to be cognizant of the contextual realities, whereby there may not be alternatives for these children. And so you need to really utilize some of the existing infrastructure to support children. Number two is that the voices, as well as young people and children together with their families, as well as the residential care institution actors, are critical to success of transition. And they should be involved and consulted at all levels and times, because they're the ones who have the bulk of work to do. They have children under their care. They have this infrastructure, and they can make or break this process. So it's very important. But also being intentional about making use of balanced messaging and case studies that counter resistance, in behavior change communication strategies, or in the way we communicate these transitions. And that is because you want to change the hearts, you want to change the minds as well of the practitioners. Last slide, please.
Peter,
thank you.
I'm here just to remind that you're over time. Thank you.
No worries.
Wrap up.
Thank you. Yes, we finished by saying that transition is a process and not an event. So it is important that it should not be rushed, but it should be gradual. It should be cognizant that, it is a process and not an event. It's not a one-day affair. Rome was not built in a day. Thank you very, very much.
Thank you so much, Peter, for your wonderful sharing based on your country context. And I would like to reiterate that, as you said, that transition is a process and not an event. Thank you for your sharing. And I would like to now move on to invite our second speaker, Dikshya Thapa, representing Care Experienced Network Nepal. Diksha is a care experienced young activist from Nepal. Sorry. Can you please mute yourself? Thank you. Co-founder of Shine Together, Care Experience Network Nepal, a master's student in clinical psychology, and working for the Himalayan Innovative Society. She's working to create a safe space to both connect and demand the rights of children and care experienced to family, identity, and aftercare services. Welcome, Diksha.
Thank you, Anju ma'am. Namaste, everyone. Firstly, thank you for having me as one of the speakers for this workshop to share on behalf of Care Experienced in Nepal. While addressing the transition of residential care institution in Nepal and across the globe, I would like to take this very moment to remember all those care experienced who often experience unexpected transitions. I had many interactions with children and young people to know their transition experience or how they took their transition when placed from institutions and in their families. So one of them shared she had just returned from her school one day and was told to pack her stuff As all children are being taken to some other place, she did not know where and why. And some told that he was not informed of what was happening. And most of them were angry to accept the fact that they had to leave their friends and go home suddenly. So what I'm trying to highlight is transition of residential care imply a transition of care experience individual young lives from institutional care setting to other family care and community-based settings. Next slide, please. When it comes to transition of residential care institutions, living care is another big challenge here in Nepal. This transition phase gets so confusing that we do not know what to do next. Home to reach, how to continue our school and colleges, how to get our legal identity on time, and most importantly, will we be safe? So these are the questions that often traumatize care experienced children young mind when left unanswered. Next slide. As we know, in Nepal and globally, we just been through pandemic phase, which is not over yet. And coming to Nepal, 2,057 children rapidly sent to their families during COVID-19 pandemic outbreak in 2020. Similarly, 547 children left institution in 2021. And currently there are 11,351 children living in the institutions. And someday their life will be in transition. Next slide, please. I would like to share about existing deinstitutionalization and transition practices through care experience perspective. We have Revised Children's Act 2018 and Implementation Guideline 2022. Based on these guidelines, government rescues children from institutions. As mentioned in the policy, children who have families, those children need to be reintegrated into family and community. And rescue of children by the government is ongoing, which is abide by the standard of operation and management of residential child care home. Even governments are encouraging institution for voluntary transitions, closure, and family reintegration. This is the most important and ongoing practice as government directives for voluntary transitions. Next slide, please. Transition is meaningful, productive, and effective when institutions and donors realize voluntary transitions. Every donor and institution should realize the psychological and long-term harms and effects of the institution on care experienced children and young people. Any transition is good for children and young people in care when it is done after the realization and wills of donors and NGOs. It should not be based on repatriation, but it should be more focused on the reintegration process and guidelines. There is step-by-step reintegration, which helps overall transition of the well-being of the children and family. Next slide. Transition is ineffective when there is no proper counseling and information to the children and young people. They have full right to information about where they will be going to.
Diksha?
What the future will be.
Diksha, sorry. I think your slides are missing here. This is the last slide you have, but you are sharing about the previous slide. Catherine, Margot, can you please help? Thank you.
Yeah, thank you. It is very much important to involve and engage children and young people during the whole transition phase. The absence of individual case plan can harm the overall well-being of the children and development of care experience. Therefore, the social worker, government should commit the proper plan from financially and emotionally to support care experience till adulthood. And case management guidelines and skilled human resources or social workers are most for the case management to work with care experienced children. We must not forget that we are playing with the lives of young hearts and minds, and one ineffective decision and their lives are at stake. Next slide, please. So what we want is very simple. We do not want anything that is not impossible to do. All we want is to remember that transition of institution means transitioning the lives of children still in care. And if we keep that in mind, I believe that will be the first step to success for the residential care institutions transitions. So engage care experienced children during the transition process, get their opinions about it, because our opinions also do matter if it is our lives that is getting transitioned. And by this time, we all are aware how important is psychosocial support and what we want to convey for the counseling support to children during and after transitions to help them identify and accept the ups and downs of the transitions. And this support must not only include care experienced people, but also the family, because the years of childhood care experienced individual has lost is the same number of the years the parents have lost their parenting experiences. They will forget how that child behaves, what their likes and dislikes are. Therefore, it is most important both for parents to be, equally have counseling support to help them connect for their long separated children, to build a good relationship once they return from transitioning phase. Another important point is to access of available services. We want to learn how things work, who to reach for services in the new communities we have written. If there are no basic service available, we would want them to get generated, because that is the special need for care experienced. Like there are policies and provision for children in need of special protection, there must be some provision in place to support children who live care, because they are the special one in needs of aftercare support. There are acts and guidelines, but we still need care reform strategy for responsible transitions. And unfortunately, we are still behind when it comes to proper documentation and monitoring. There are no official database management regarding how many children are residential care institution, both registered and unregistered. And sometimes I often worry for those children who are in unregistered institutions, because who knows what they are going through. So therefore, monitoring and mapping must be the prioritized if we aim to save children who are at risk. And there must be skilled manpower to do this task. Like I said, we are talking the care experience lives here, playing with young children's minds and hearts. Therefore, skilled social worker and profession are the ones needed for the effective transition. And as they say, it takes a village to raise a child. So does a care experience individual, especially when they have had a rough transition in their life. What we want through cannot be undone, what we cannot change to the past and what has been done. This is what we have realized while getting this far. But bright side is we have this opportunity to create a safer support system for those children who are living care, as we are discussing the issues here also. And our network Sign Together will always keep this in mind and move ahead, all for the care experienced children and young people. Thank you.
Thank you so much, Diksha. That was on time. Thank you for the wonderful presentation, sharing on behalf of Care Experienced, both from Peter and your presentation. It's so powerful to hear the engagement of Care Experienced throughout the transition process. Thank you again. Now I would like to welcome our third speaker, Wandeo Humphrey, who is the Director of Children's Services, Kisumu, Kenya, representing Government Experts Panel. Wandeo has served in various child protection coordination roles, including both the county director for Siaya and Kisumu counties. He has more than 10 years curriculum development experience in childcare and protection for various learning institutions. Currently, Wandeo is overseeing the piloting of alternative family care guidelines in Kisumu County, where he serves as a county director. Sorry. Welcome, Wandeo. Over to you.
Thank you very much, Anju, and thank you, everyone. I'm here on behalf of the Director of Children's Services, Kenya. And next slide. I want to say that the process of transition from residential care to family-based care can only work very well when planning is done and done very well to ensure the safety of the children that are being transitioned. Next slide. Now, in our implementation or piloting of the transition, there are a number of elements that proved to us very critical that help us to transition children back to the family care. Now, one key element that really was very helpful is the government of Kenya created an enabling environment for all the actors in childcare. The government created laws, policies, and more so guideline that was simply domesticating the UNCRC guideline on alternative family care that we launched, and we were using as a guide, a framework for implementation. So the government created an environment for us to work. Next slide. The next element was, as we started the program, capacity enhancement programs were put in place to enable all the partners, the players, the social workers to embrace new approaches to support care transition. We note that trainings on alternative family care, case management for integration, so that there was that embrace of the new approach, which was very critical. And the stakeholder engagement. This was also done to create a shared understanding of the transition of care concept. And this helped in strengthening and promoting family care and community-based care for children. The community gatekeepers, like the chiefs, the child protection volunteers, which is a concept that really was very helpful in our situation in Kenya, because they reach up to the villages where children are integrated. So that concept of gatekeeping was very key in promoting community-based care. Next slide. Another key element that was important in care transition was the strengthening and identification of the already existing family and community-based forms of care. I'm referring to traditional care practices like kafala, kinship, which are very popular. And as at now, the community, these practices that are within the natural and community context have now been captured in our new law, the Children's Act. There was also the existence of information, the reference material, because we were in touch with various countries that had developed some milestones in care transition, like Rwanda, Italy. So we use some of the references. The reference material is very key, very critical in the information dissemination among the actors and learners from countries. We got this from countries like Rwanda and Italy. Next slide. During the transition, it came out very clearly that certain safeguards had not been well taken care of. And this included the child care coordination mechanism, which was already in existence, but was not strong enough to address the issues of children that have been transitioned and also the institutions that were transitioning. So the coordination mechanism was not really strong to help in transition. Another gap that we also experienced in our country is the technical capacity, particularly the social workforce. We noted that a number of players still lacked the knowledge on the best practices on transition, and this therefore was a critical gap. Then there was also the inexistence of care structures, of clear care transition guidelines. And this was noticed because there was no strategy that would help in guiding the practice, guiding the child care actors, so that we have an enhanced vision and practice amongst the actors. Next slide. Another important component that we also experienced was resource allocation for transition was inadequate. You realize that this affects interventions, this affects transition. Budgeting for transition was not adequate or was very thin or is thin in that matter. And therefore, when planning for transition, budgeting is necessary specifically for transition. Another issue that we experienced was scarce documentation of promising practices that would enhance learning and reflection amongst implementers. You notice that there was very little referral materials that could be used by everybody, and more so documenting the practices that have achieved well in transition. They were there, but scarce. Next slide. What would be my recommendation based on our experience in transition? As it's always said, the principle of best interest of the child should be the overriding guiding principle in the transition process. We realize that sometimes transition, when done haphazardly, without looking at the best interest of the child, not the best interest of the government or the practitioners, then we end up affecting the child, or transition becomes moribund, it may not really work. There is also need to establish care transition guidelines, a roadmap that guides the process with enhanced shared vision and monitoring framework to rally all the actors to support its implementation. A strategy that would be helpful and would be used by all the actors in transition. The third thing that I would also want to recommend based on our experience, the costing of care to process, there should be allocation, costing of care transition process to inform resource allocation. We realize that costing here is important because at times the numbers of children in institutions and the institutions that are there, we may not we need to cost so that we are able to know how much we'll require in transition. Then there is also need to have enhanced documentation and establishment of data that is critical to inform programming and scale up best practices. Then there is also the need to adhere to policy framework during implementation among childcare actors. Next slide. Next slide.
Mr. Wandeo, as the time is over, could you please wrap up your presentation? Thank you.
Well, now skilled and dedicated personnel, very critical, and a strengthening of family is also very critical in transition. Otherwise, clearly defined child protection system to capture, be able to track children that are reintegrated, and also institutions, it's very critical to reduce cases of children disappearing in the name of transition. Thank you very much.
Thank you, Mr. Wandeo. It was so encouraging actually to hear from you firsthand about the efforts from your government in Kenya. And we would like to definitely listen more through the discussion when we have Q&A sessions. So I would like to remind our participants, our friends here, I can see there are 100 participants currently still joining us from different parts of the globe. Please feel free to keep your questions in the chat box. Thank you. And now I would like to invite our next speaker. Let me just give me a second to just scroll down. Yes, it's Susan. So Susan, I would like to, yeah, sorry, it's here. I'm sorry for that. Susan Alamaai is our fourth speaker from Tororo district. She's a senior probation and social welfare officer in Uganda, and she's representing government experts panel. She has worked with Tororo district local government and has over 10 years of experience. She's highly committed to the review, adoption, and implementation of care reforms of children. Susan is an advocate for the rights of children and works to promote justice for all children in conflict and contact with the law. She has been in the journey of getting children back to family and ensuring they thrive in families. She is passionate for all children to realize their full potential at family level and communities. Welcome, Susan. Over to you.
Thank you, Anju. Members, sorry about my video. It keeps going on and off, but it's a pleasure to be with you this afternoon. And I'm here to share with you an experience of the transition journey in Tororo district. Tororo district is a district local government. It's a higher local government because the lower one is the sub-county. Let's proceed, please. We had this, what was our situation before the deinstitutionalization? All missing and abandoned children were automatically sent to the children's homes, Smile Africa Ministries, a Wandeo house run by missionaries, and the Salvation Army Tororo Children's Home. And when children were placed there, they were automatically forgotten as no further effort was made to trace relatives nor improve on the situation at home. Parental responsibility degenerated in this situation, and the institutions continued to be the easy option to consider for child placement when the primary carer died or got issues that could separate the child from the family. Next. Next, please. Someone changing the slides, please. So, what opportunities did we have for this for the deinstitutionalization to succeed? The first was available and functional community-based services department, staff with a high level of expertise in community mobilization, available community volunteers with basic training that could be given additional knowledge and skills. Before the DI, we had an opportunity to partner with some projects to train community volunteers. We also had draft guidelines in place that we were allowed to pilot in the transition. Uganda being a signatory to the UNCRC and accompanying protocols was an opportunity for us. And the fact that the district is an autonomous entity that chooses what can be implemented within its jurisdiction for the common good of its citizens. Next, please. We moved into strengthen community-based care, child care structures, training of community paraprofessionals, the parasocial workers in identification, reporting, referral, and of violence against children matters, creating awareness and consciousness of the importance of each child being raised in a family. And this was in partnership with our partner Child's Eye Foundation, which is an international organization. We also did mobilization, training, and qualification of foster and adoptive parents in the district. Out of 80 that expressed interest, 40 qualified because the other 40 were asking for whether they had benefits coming, and we inevitably had to constitute and train our alternative care panel, which was operationalized. And to date, we have 25 children having been placed in different forms of alternative care. And we've had those 9 meetings since that time. The 25 children did not have any traceable relative, therefore they had to go into different permanent care. Our community volunteers leading by example to provide foster care and acting as promoters of alternative care in the community, as well as economic empowerment initiatives for vulnerable children. That's what enabled us to strengthen our community-based care, child-based care structures that made it possible for us to transition. Next, please. What challenges did we have? The first one is inadequate funding to support families with income-generating activities. The other challenge is inadequate funding to the sector responsible for children, and that is how we have partnership with non-government organizations. And then children in independent living are most challenged because of the prolonged stay in institutional care programs. In institutions, it's a one-size kind of upbringing for children. So the 16-year-old who should be going towards independent living is also being treated like a child. And when you get them out of there, the support needs to be tight so that they don't fall off the protection lens. Next, what opportunities existed? We had a strong technical support and technical support supervision by the top management in the district. This is the chief executive officer, the head of the district chairperson, and then the resident district commissioner. We have also had the opportunity of growing willingness of families to take responsibility for children after awareness is created. One, by training the community volunteers and the volunteers who have been leading by example, who have now turned into promoters, are a plus for us. Existing political will for community-based care of children, they have seen that it works and they have embraced it with both hands. The other opportunity is the strong referral network, well coordinated by the community-based services department at lower level. This is comprised of the social welfare workforce. The other opportunity is the opportunity to pilot the different policy guidelines from the line government ministry has promoted learning, enhanced collaboration with non-state actors that has provided long-term educational support to children in alternative care. Most of our alternative parents who came into taking children are people with modest incomes, and therefore they needed some bursaries to support their children. strong regulatory structure for managing organizations through coordinated registration and signing of MOUs. This regulates and tries to glean off those who would otherwise want to come and abuse the system. And then finally, among the opportunities, the adoption of safeguarding approaches to prevent separation of children from family. And of course, I will not fail to mention that the other opportunities and a partner at national level that had the vision and the mind to support Tororo district local government to learn and therefore be able to showcase this. Next slide, please. What recommendations? Governments should start by ratifying the UNCRC if they have not yet done that, alongside other relevant protocols, and domesticate them. The other recommendation is for governments to allocate a conditional grant to the child sector to facilitate care and protection of children within the family and community. This will go a long way in building community ownership. And the other recommendation is strengthening the community paraprofessionals in the community. Those structures that are there are vital in the success of transitioning, getting children out of institutions. Finally, it's also important that we build strong alliances to address the issues of funding gaps. I work in a local government. The national level gives us something modest for supporting children. So to close that gap, we need to build alliances, strong alliances like we have with Child's Eye Foundation, among others. I don't know if I still have a slide. I just want to conclude by saying there is more to learn over the years from today's lessons. Thank you, Peter. Thank you, Humphrey, and the rest whose names are a bit hard. I want to say this for God and my country, Uganda. God bless us all. Thank you.
Thank you so much, Susan, for that last prayer and wish for all of us, and for your sharing based on your country, Uganda, and your insights, your learnings, and the transition efforts and challenges which you have shared recently will help us guide the thematic brief for the transition working group. Thank you so much. Now I would like to request Gift Kanthamanee, who is our fifth speaker, representing civil society and NGO experts panel. Gift is an advisor for Alternative Care Thailand and a lecturer of religion and development program at Mahidol University. She was part of a team drafting Thailand's Alternative Care National Action Plan, which was recently approved and is being integrated into the government's work plan for 2023 onward. She is currently conducting a few research projects on children without parental care and their families' needs, and the prevalence of institutional care in Thailand. Welcome, Gift.
Thank you, Anju. And Sawadika, good evening from Bangkok, Thailand. I'm representing the Alternative Care Thailand group, a network of NGOs that works together for the same goal to make certain that care reform would happen in Thailand. And if I have my slide, today's slide is on key lessons on residential care service transition. I'm not sure whether I can claim that Thailand has made a lot of progress or not, but indeed, it is a progress that we made in 2021. Currently, we had some progress that we celebrated, which is that the government of Thailand has made a statement of commitment to transition to family and community-based care. So even though it might be minor step for many countries that that I just have listened, but for us it's a huge success already because we have been at least a few decades to try to transition to family-based care, and especially the last 7 years of intentional advocacy that all the NGOs put all the efforts together to make it happen. So not only that the government just recently made a commitment last year, or actually continue to this year as well, we have just had an approved national action plan for alternative care in Thailand. So that's a progress that I share with you and ask you to celebrate with us, even though it might be minor to many of you. However, when I'm asked about what's the most critical elements for scaling up transition, um, I I know that there are 100 factors helping to scale up the transitioning, but for us, it's actually the personal relationship, which is might be funny because we thought about, we talk about the legal system, we talk about all the formal factors that put into this effort, but in reality, is the personal relationship that sustains it. I mean, when the CSO try to share or provide the trainings, when people don't believe in alternative care yet, they don't see why we should transition children out of residential care. We need something to sustain it along this way. And what happened is that it's the personal relationship that helps us. It's the personal relationships that bind us together and work even though on voluntary basis. Many people work even long hours, meeting at midnight to make sure that things happen. So it's personal relationship, but not only for NGOs, also personal relationship with the government key staff. And that's how we get many of the things done in the progress of transitioning. Also, the pressure, both from domestic, which is, for example, from media, and when something came up, we use that pressure to pressure the government that we need some changes. We also use a lot of international pressure. For example, when the government of Australia make that regulations on not visiting orphanages. That is some kind of the pressure that we're looking for because we can use as for the government to make changes. But what is missing? What's missing is that the children are not only in orphanages and under one ministry alone. In the next slides, I share with you that we miss the interministerial collaborations between the government agencies. And if we have that, there will be a better, a whole picture of transitioning. And we do hope that it would come about after the alternative care action plan has been approved last month. Another thing that has not been there fully, is the donor awareness. We still have, and if I give the example, in one district alone, in the border of Thai and Myanmar border, we have the budget or the private residential care institution spent 2.7 million US dollars in one district alone in Thailand. So the donor has not been aware about these changes and what's the best interest of the child that should shape their ways of donating and their way of supporting children without adequate parental care. The other things that is missing or not fully there is the alternatives. Thai people, predominantly, we are Buddhist country, and people likes to make merits, and especially on birthdays and the places that they go to are orphanages to make merits. We do not have the alternatives, identities, or units for them to make merit and support family because what they only see are orphanages that are everywhere and there are children there that need help. So we need an alternative for the public to support families more than orphanages. My recommendation, and this is contextualized recommendations, it might not work in many countries, but in Thailand, we know that we started off by building a lot of evidences. And CSO are the one who actually start the building evidence first. For example, we survey or counting number of private residential care in the country, and that without the government help at first, we did the research on practice of private residential care that are registered with the government and see that there's still gaps between their practice and the UN guidelines. The other thing that the recommendation that I would make today is that we have to be very, very careful in a country where they do not agree yet with the transitioning, that we need to use the language that is positive enough for them to not have a strong resistance to change. For example, instead of saying change or saying something that would stir their fears, we actually say that everyone has a good heart, but we need to recognize together the limitations of institutions, for example. The third one is that we see that when we talk about transitioning, we always focus on getting children out of institutions and go back to their family preferably. But the reality is that sometimes we forget to emphasize on preventations. We forget to emphasize on gatekeepings and family strengthenings, up to the point where some people say, so you are closing down the orphanages, but where are children going? So they don't see the whole picture, the big picture, that actually there's a preventative side of transitioning as well that we need to focus more. The fourth point is that the CSO or the NGOs need to not ally closely with the government, but also not too hostile. So my point is that you need to position the CSO quite well. You can't please the government every time, but at the same time, we will not be too hostile toward the government. And by keep the balance on the position of CSO and NGO wells, we're actually getting things further. And the last one, which is quite contextualized in Thailand, is that we have to define all types of residential care and sometimes even beyond the definitions written in UN guidelines. We have to also take into account the boarding school, especially charity boarding schools that function as private orphanages or in many cases public, the religious schools, churches, temples that function exactly the same as residential care. To count all of these as residential care, we actually know that we do not leave any child behind on this transitioning process. So that's the contributions from Thailand. Thank you.
Thank you. Thank you, Gift. Thank you so much, actually. And we would like to definitely say congratulations to you and your country for coming so far in transition. And I'm sure that our friends here will have some interesting questions to you during the Q&A sessions as well. Thank you. Now, continuing this important discussion and sharing, I would like to welcome our final speaker for the day, Philip Aspegren from Casa Viva in Costa Rica, representing civil society panelist. Phil is a passionate Phil is passionate about seeing children connected to families. After directing children's homes in the Dominican Republic, he and his wife developed a child and family agency in Costa Rica. Now he helps children's homes expand their services to care for children in families. Welcome, Phil, and I look forward to meet you in Kathmandu soon.
Thank you, Anyo, and thank you to all of the presenters today. This is an important topic, and I'm pleased to be part of it. We were excited when a Central American president recently made a commitment to deinstitutionalize all of their children between the ages of 0 to 3 in our country, with hundreds of children in that age category in baby homes. We believe this was an important first step towards family-based solutions for children. However, within 6 months, the president claimed success, saying she had deinstitutionalized all of the children 0 to 3 years old in her country. We couldn't figure it out. And so when we investigated, we found out what really happened. The 50 government-operated children's homes had removed all of their children ages 0 to 3, but they sent them to private orphanages. The president claimed victory, but the children were simply shuffled from one government children's home to private children's home. So though the president made a commitment to deinstitutionalize, neither the president nor the National Child Welfare Organization understood what that deinstitutionalization meant. Moving children out of government homes is a good step, but unless we take into account the private children's homes, we will only solve part of the problem. So what have been the factors that lead to change, especially when we look at the partnership between governments and non-governmental children's homes? Number one, exposure to new ideas and training starts the change. In Latin America, that started in the 1990s when the abuses in the international adoption system were exposed. This was one of the catalysts that led to awareness raising and the need for different solutions. Training was critical. We had to be exposed to tangible experiences, how children could be cared for in families. The international NGOs like UNICEF and Save the Children provided that first exposure to the idea that children grow best in families. Then smaller organizations came in and provided training in trauma-informed care, the importance of connected relationships, and began to offer practical exposure showing what care could look like in families. Exposure to new ideas starts the change. Number two, a commitment and a plan by governments, NGOs, and civil society to move children toward family. The process with a declaration of their commitment towards deinstitutionalization and family-based care that includes a plan and a reasonable time frame for change. When this is done too fast or without a clear plan, it can be dangerous. In another Central American country, the government announced it was going to close all of the orphanages in their country, and they succeeded in closing at least 1/3 of them. However, they had not taken the time to develop the capacity for family reunification or alternative family care. And while they worked to develop that capacity, they housed the children in a large facility in the capital. When I visited that home, there were over 500 children living on the campus. The children walked from building to building in single file. The adults wore white lab jackets. The children have been removed from dozens of small, comparatively personal children's homes and ended up in a large institution. We need to have a plan in place for how we're going to move these children, and we need to have a realizable time frame for accomplishing that change. Number three, an openness of governments to partner with NGOs and civil society in the implementation of care reform. Small NGOs, small children's homes have been a significant part of the solution for separated children in countries around the world. The opportunity exists for those same children's homes to expand their care offerings beyond just offering residential programs. Under the supervision of the governmental child welfare agency, they can prepare and supervise the placement of children in reunified or alternative families. Globally, we've seen children's homes greatly expand their impact. Before, they had dozens of children living on their campus, and now they are caring for hundreds of children in reunified and alternative families. The small children's homes in the countries have a tremendous opportunity in front of them. They are located in communities where they are well positioned to support reunified and alternative families. They are already connected to churches and community organizations that can be engaged in the solution. And they are small and agile and can provide more personalized services than what a government is able to do. It is making that shift from the children's home saying, we provide services for the children living on our campus, to saying, we provide services to the families in our community and the children in those families. An example in Honduras, the DNAF in Honduras has decided to develop their foster care through a partnership with NGOs rather than doing it themselves. When the government does not agree to work with the NGOs, the small children's homes, it's in effect the government is saying, we will do it alone. And they miss out on the myriad of connections with families, churches, and communities, which the children's homes already have. Number four, a local champion carries the torch and a guide is present to show the way. Someone must lead. This can be a group of people, can be an individual, might be people from the government, might be people from NGOs or an outside person who has a passion to see this come about. Ideally, it is all of them working together. Neutral groups like Paraguay Protects Families play an important role advocating for change. Paraguay protects families, assembled various government agencies, NGOs, court, and other types of actors to build a three-dimensional map showing the path that children took through the national care system. Once they could see the process, they recognized the problem areas and were able to address them. These leaders also need a guide who can show them the way. In Panama, one of the leaders of the organization, I Believe in Family, a guy named Jerry, came here to Costa Rica to view a child and family agency in action. Though he had been working to develop family-based solutions for over a year, once he visited a real foster family, he told me, now I understand. I was in the trainings, I've seen the videos, I've been selling the idea to others, but until I sat in that living room and got to know the foster family and the child they were caring for, I didn't really understand what it meant. Generally, people are open to change, but they need a guide to show them the way. Number 5, and my time is almost up. We learn from doing. We need to place children and families. We will fail, but we will learn and we will improve. If we don't begin, we will never see the change. The hardest child to place in a family is the first one. So in closing, I'd like to encourage you to train and learn, to make a commitment to change, to develop healthy relationships between the children's homes and the government, lead through clear planning, and move children to families. Thank you very much.
Thank you, Phil. Thank you so much for sharing your efforts in your country, Costa Rica. And as you said, that we all need local champions and a guide. I truly believe in that. And we have them. You're not alone in this, we're together. Thank you. With your presentation, now I'm so happy and excited to move on to the next question and answer session. And here I would like to take help from my colleagues who are working behind the scene and also checking the chat box if we have any questions to our panelists. I would encourage all our panelists, all 6 of them, to kindly turn on your videos and let's start to have some interaction. And I'm also checking a chat box. Friends, I would really appreciate and invite everybody to feel free and let's learn, or if you have any queries in your head or you want to congratulate someone here for their decade-long experiences and efforts, please feel free to come in. There will be translation of questions in Spanish. Thank you, Kelly, for that. And I'm just checking. If we have any questions here.
Hello, I have a question.
Yes, please. Is it Grace?
Yes, it's Grace. So my name is Grace Berry. I'm from Nairobi, Kenya. Thank you, Peter, Mr. Wandeo, for representing the care reform efforts here in Kenya and also all the facilitators. So for me, maybe just to put it out there, first was maybe the statement that Gift said, CSO and NGOs should not please the government in terms of how they relate with them. And maybe I'd like him to talk more on that, because also maybe here in Kenya, how that relationship is, how can other people, CSO, adopt that? The other question goes also to Mr. Wandeo in terms of the enabling environment. Yes, I do acknowledge the Kenyan government has really created that enabling environment, and maybe just going deeper to implementation. How can the government also support the CSO to actually implement it? We understand the government sometimes do not have adequate resources, but how can they support their work in that we have scenarios whereby the government are requesting to be facilitated, to be accompanied to implement these care reform activities. So how can the government support other than make the CSO feel like it's quite a hard time pulling in the government and paying for their own resources to actually implement these resources? So yeah, that is one. The other question, and then maybe the last question is in terms of the children who are in residential institutions, how do we perceive, yes, we are all desiring transitioning, and it's all for the best interest of these children. But how do we, as we transition, not bow to the pressures of getting to numbers, like pleasing numbers, how many children were integrated? How do we avoid working towards a reintegration and transition, but not, which might lead to harming children more? How do we ensure this process is smooth and safe and effective so that children are not harmed in the process? Thank you.
Thank you, Grace. Mr. Wandeo, would you like to respond to that? And
Yes.
I would like to, yeah, please go ahead. Thank you.
Yes, thank you, Grace, for those questions. It is true the government has provided enabling environment, and a number of times funding is a problem for the government because budgeting has not been done appropriately on transition. However, government has an open door to work with civil society organizations. And as we speak, there are a number of civil society organizations that are working with the government in transition. If you are a Kenyan, you know that we have SOS, Changing the Way We Care. We have UNICEF, which is playing a major role in Stahili, and many others that are working with the government. But the government has to be part of the exercise to bring in some structure of ensuring that the right thing is done for the child. It will not be right for the government to leave it open without some controls. The work of the government also is to develop policies, and these policies have to be utilized within a structure. That is why the government is involved and works very closely with the civil society organizations that are ready and are willing and have the financial support that they provide in transition. Then the second thing that you ask about, ensuring that children that are being transited are not just thrown back into the family or the society without safeguards. And as a government, we note that case management for integration is very critical. And this is not a one-off event. It is an event that takes care of the child, the processing, the identification of the child until the child is reintegrated back at home. And the safeguards, the safeguards are there because within the community, the government has also come up with safeguarding mechanisms, and people are being taken through those safeguarding mechanisms to ensure that the children that are taken reintegrated are still protected at home. Thank you. Thank you. Over. Hello?
Thank you, Mr. Wandeo, for your response. Susan, would you like to, you raise your hand? Would you like to respond?
Yeah, thank you. I have actually seen on the chat, somebody is asking a question translated from Spanish. What is the importance of training technical people, and what are the ideas for strengthening practices in their area of this area of specialization? One, I will speak for my own country. One, there are technical people. When we talk about the social welfare workforce, there are things, even when we talk about transitioning, deinstitutionalization, there are things that have been tried out by an organization somewhere. And when we see that it works, we want it to be scaled up. An organization may focus in one community, maybe one district. In the case of Uganda, we have 140 something districts. So when you train the technical people, they're able to carry it down to, it's called cascaded down. That is important, and they have the mandate to carry on this work. So someone carrying a mandate and doesn't have the finer detail of how to handle a matter is likely to misfire. So because we are co-actors in this arena of the human capital, it is important that we work together and we do what? We empower government to do their business. And what are some ways to build those relationships with government officials?
Susan,
yes,
there is one very important question in the chat box where the question is about what motivated government and how to establish concrete relationships between government and NGOs.
Okay, what motivated government? For the case of Uganda, what happened is there was this study about the negative impact of institutionalization on children. It is something that is tested. Psychologists have been part of it, different people, and that validated study is what touched the hearts of the different people in these offices. And then they realized that we think it's a soft way of dealing with children. When I started, my first slide was about what was the position before it. It was the easy option. But now you go beyond looking at a situation to looking at the individual in that situation. That is the importance of that. So when we got to know these studies, the outcomes, we realized where our mistakes were, and so we moved forward with the idea. And as we speak today, I don't have even one institution standing in Tororo. All of them got phased out, and now they are running community hubs, which benefit more than the number of children which used to be in that home. So you see the impact is bigger than when you are confined to one small area. We need to build synergies in doing this work, and it's going to work. The burden will not be much. Thank you.
Thank you, Susan. Well said. The negative impacts of child institutionalization. And that's why we have Diksha and Peter sharing on behalf of the care experienced young person's lives. Now I would like to go to the next question, and it's to Gift. You made a point about the importance of relationships to support transition. And what are some ways to build those relationships, including with government officials? How do you address the issue or government staff turnover in this process?
Thank you. And I would answer. Thank you, Florence, for the question. And hello to you as well. Glad to see you. Your question is very, very important. How we build the relationship. It might sound cheesy a bit, but actually, when we talk about the work we do as a network of NGOs, we always use the term for the children's sake. So you know that with this term, and if you stay true to it, you can meet on Zoom at 3 a.m. sometimes or midnight sometimes to make things happen. And with this, as I say, it sounds cheesy a bit, but with this, you actually attract the like-minded. You within times, very short time, if people do not believe in this, they will just leave. So you have a core group that really believe in it and share the same goal. So that's how we build a relationship. It's almost like a family here, a safe space for us to share everything amongst the NGOs, the network of NGOs, and work together. So to answer Florence's question, and another question that Florence raised is the challenge of the government officials rotating the positions. You see me crying there. It's a challenge that we always face here in Thailand, and I'm sure in many countries. So the approach that we took is that we predict for them the successors. We kind of see who would come next in the key position, and we invest in them while we can. But that's never enough. So another approach that we do it in parallel is to integrate the action plan into the action work of the government. So even the officials are rotated, the work is there. And if you predict it rightly, that's perfect. But if not, those that rotating to the key position that needs to work with you, they will run for you for advice and support. So that's how we addressed it. And I would take this opportunity to answer Grace's question as well on the relationship with the government counterparts. What I say is that you shouldn't be too close to the government and always please the government, because we work for the children and not for the government as NGOs. So we need to have the clear mind on who is our boss here and who we work for. But however, we need to build trust, and our government counterparts are brilliant. They are very, very kind here. We need to build trust with them to work together. So not too close. We're not pleasing the government, but it's very, very important for NGO in any place, I think, to be a watchdog and ready to say where are the gaps between the practice of the government or the private sector for that matter, the gap between their practices and the UN guidelines, for example. So I think that's how we should position the NGOs and CSO. Thank you.
Thank you, Gift. Yes, finding champions in our communities, whether it's in government, whether it's the donor community, whether it's the civil society, we need to find the local champions. It's so important. And thank you for sharing what you're doing in your country. Philip, I would like to request you to answer one question, which is, how do you practically lead with the principle of the best interest of children, realizing that there are competing interests from donors, governments, and NGOs, etc.? Would you like to address this question, please?
Sure, that'd be great. That question came from Ellie Oswald of the Faith to Action Initiative, which is a page that has excellent resources for those that are interested in learning more about transition. I think the biggest error that I see in deinstitutionalization is when children's homes move from the one model of care, which is on their campus residential care, to another model of care, which is moving children to families or reunification, instead of looking at each child's individual and personalized needs. When we look at the best interest of each child, when we look into each child and say, what does this child need? Who are the connections that this child has? What's this child's past story? What's their opportunities? Where can that child go? And when we make the right decision for each child, and then do that for every child, we will have the program. We will have the best program that we need. What we don't need is a new institutional model of care that places children in families. What we need is a system that looks at each child individually, makes the right decision and the right action for that child. And it's complicated because there are so many different competing interests. If an orphanage director feels like their income is directly tied to how many children they have living on their campus, they're going to be very motivated to keep those children living on their campus, and particularly if those funds are coming from an international NGO and international donor. And so we have to build new structures, new systems that are going to allow for those children's homes directors to feel like they are being successful when they are caring for children in families. First question that gets asked the children's home director is, how many children do you have living on your campus? And they need to answer that. They need to change that question by responding and saying how many children and families they are serving in their community, rather than talking about the children that are living on their campus. It is a big paradigm shift, a difficult process, but it is possible to do.
Thanks, Philip. And a great reminder, it's a difficult process. Transition does take time, but it is doable, as our other colleagues also mentioned in group discussions. Thank you, Philip, to address that question. And I'm just checking here if we have any more questions from our friends here who are still joining us. Yes, there is one which I would like to direct to Diksha. Sorry, apologies from Peter as he had to leave because of an emergency. So Diksha, if you would like to respond to this question, where how you can reflect on how your government should engage, according to you, how government should engage and resource care levers networks to be involved in developing and implementing national level transition. How do you ensure meaningful engagement so that care experienced voices are heard and your demands are put there? Thank you.
Thank you for the questions. From my experience, I believe, first of all, as I mentioned earlier also that there must be data and documentation of care experience. And once they have proper data and documentation of care experience, they can invite a large number of care experience or small number of care experience. And they can also make a, like talk show where they can raise their voices, including what can be good for institutional care. If all the data and all the recommendations made by care experience can be implemented properly, and the suggestions can be taken properly from care experience, because they have the experience of being in institutional care and separated from their families for a very long period of time, and they can only provide a good suggestion for upcoming generations. And apart from that, giving a platform to care experienced to invite them and talking with them about the recommendation from care experienced, or they can even organize some webinar or some programs related to children in care and care experience. So this way, more involvement of care experience in decision-making process for care reform strategy. So this can be done from Nepal's side.
Thank you, Diksha. And it's so important to have care experienced young persons in every phase of from planning to decision making and to implementation of transitioning residential care services. Thank you for reflecting your thoughts on that. And with this, I do not see any questions here in the chat box, and I would like to thank all our friends who have joined and have put their questions. And I hope that the answers, you are happy with the answers. And if you would like to connect more and would like to have any specific questions to our panelists, please feel free to connect. Thank you. And with this, I would like to wrap up the question and answer sessions with key learnings from our panelist discussions. I would like to just reflect the key learnings over here. Throughout this nearly 2 hours of discussion, it's very clear that there needs to be clear enabling policies and national action plans and roadmaps to create a framework to support transition of residential care services. It needs to be clearly defined in policy and capture all types of residential care which is in the country. This is important to ensure transition is understood as applicable to all types of residential care facilities, and that no children will be left behind or shifted from one institution to another. In addition, our panelists have also flagged that there needs to be political will to implement these policies and enforce them also. This is particularly important to create accountability and to empower and provide the backing to the civil society organizations who are supporting governments by providing technical support to throughout the residential care services transitioning. There were very important points mentioned about the coordination mechanism to facilitate government and civil society collaboration in implementing national plans, roadmaps also must be developed. This is very critical to scaling transition whilst ensuring good practices. Our panelists also flagged that there is a need to increase investment in capacity building of directors, mandated authorities, social workers, case managers, and community gatekeepers. There is a need to expose stakeholders to tangible examples and experiences of alternatives that's available. This is key to enabling transition and reintegration and to also ensuring that we have good practices in place. One of our panelists mentioned about behavior change and communication campaigns, which are very critical towards the transitioning phase. Changing community attitudes towards residential care is key to enabling and scaling transition services. When community attitudes change, families contribute towards the pressure exerted on residential care services to transition. It is very important to disseminate clear information on what transition is and what it means to all stakeholders, as we know that there is fear to transition. So donors in particular also need to be engaged. That was very clearly shared by our panelists. Care experienced persons need to be engaged and involved in transition efforts and supported to do so. Their voice and experience is highly influential in catalyzing transition, as rightly said by Peter and Diksha. Building the evidence-based collection of data, evidence the scale of the issue and gaps between the situation in the country and the international commitments and UN guidelines. Our panelists shared about the experience of reintegration, which is a common factor that catalyzes transition across many countries. However, reintegration itself does not equate to transition. That we all need to be clear. And honestly, 3 years ago, even I did not have that clarity. But as we learn and understand better through the practices done in many other countries, and we come together to actually define what the transition process is. That's why it is so important to understand the phases of transition. It is important to intentionally and strategically leverage reintegration experiences amongst residential care services to move towards transition. We also spoke about moratoriums, which are an important mechanism that signal change and a strong stance and intention by government to reforming the care system. They play an important role in catalyzing decisions amongst directors and donors for transition. Messaging needs to help RCI directors to see that transition does not mean the closure of their organization, but it is a reorientation of how they support children. And we use and be very careful about the positive language and be aware of stakeholders' reactions to language, as Gift and our other panelists time and again reminded us, and how this can create barriers. There were discussion and very important points about the transition of young people out of care needs to be carefully considered during the RCI transition. There is a need for continuity for education is a key concern for young people. Need more information on how to transition to show the practical steps and to make it seem more feasible. We need more documentation and promising practices to enhance learning amongst implementers. Children's best interests need to remain at the center of all transition strategies, plans, and efforts. The practical barriers to reintegration are also barriers to transition as it impacts directors' perception of transition as being implementable and feasible, and therefore discourages buy-in. There is a need to develop the alternatives, including building upon traditional family-based care practices when government directives go ahead of the community-based services and the services aren't available. It is interesting to note that our panelists also flagged about the community ownership, which is very important. There is a need to engage communities, build their capacity, and involve them in setting the vision of family-based care. Personal relationships within and between committed government officials and CSOs sustain action, even when it is slow, and is key to achieving transition at scale. And finally, the international commitments and stances and action taken by other countries creates international pressure that catalyzes transition. So these were the key learnings from this event today. And I'm so happy to share with you all that the recordings of this session will be provided to you all very soon. And I would like to, before closing, I would like to just say a big thank you to everyone who are here. You'll receive the workshop report in the coming weeks. Oh, I'm sorry, there is a slide which has popped up, and we have a poll. So, may I request everyone to kindly provide your response to this poll. And the question, which is very important for all of us here, is what is most needed to systematically scale up transition of RCI services as part of national level care reform efforts? So this is a question to you all, and I would like to encourage and request everyone for your insights here somewhere in the chat box. I believe, not in the chat box, it must have come in your screen. Could you please answer to that? I repeat the question. What is most needed to systematically scale up transition of RCI services as part of national level care reform efforts? Your feedback is very important to us and will be reflected in the meeting report also, which we'll be sharing in the coming weeks. Thank you so much, friends, for being with us today. You'll be receiving the workshop report and the slides and the recording of the sessions in English and Spanish. Before I close, I take this opportunity to invite you to join the transitioning working group and become a part of this learning community of practitioners where we are developing the 2023 transition working group work plan. I have my wonderful colleagues and co-facilitators, Rebecca from Better Care Network and Suli from Changing the Way We Care in Guatemala in the working group. Thank you to our Better Care Network colleagues, Catherine, Margot, Kelly from Changing the Way We Care, moderating for Spanish-speaking participants, David presenting synthesis of country-level report, facilitators Suli, Ashley, and Khadija, our panel experts, Peter, Diksha, Wandeo, Susan, Gift, and Phil, and to all our wonderful friends who have joined us from different parts of the world. I close the event reiterating a government official's recent statement in Nepal to the municipalities officials. She said, institutions or residential care services in your villages and communities is not an indicator of development, but transition to family care is. Thank you and take care.